Welcome back to Pediatrics To-Go. Today we're going to be talking about a very important topic, and we have Dr. Mary and Dr. Marianne that will be here discussing VSD in children. Now, people ask, what is VSD? It's actually a ventricular septal defect, which is in pediatrics usually congenital. So, Dr. Mary, introduce yourself and take it away.
Okay, I'm Dr. Miriam, and I'll be talking about ventricular septal defect. That's the VSD. So VSD is a congenital heart disease. It means that there's a structural abnormality with the heart which occurs at birth, and it is one of the most common congenital heart diseases that we have. So for ventricular septal defect, to break it down, what it means is that there is a hole in the heart. So the heart has 4 chambers. We have the 2 upper chambers known as the atria and the 2 lower chambers known as the ventricle. So these lower chambers are divided by a septum. This ventricular septal defect is just a defect in this septum that divides the both ventricles.
So the septum is like a wall?
Yes, like a wall between the 2 ventricles.
Okay.
Yes, so once there's the hole in this wall, encourages a mixture of blood from the left side of the heart to the right side of the heart, meaning there's a left to right shunt. The right side carries oxygen poor blood, while the left side carries oxygen rich blood. Yes. Right. So the blood flows from the oxygen rich side to the oxygen poor side of the heart, and this leads to a backflow of blood into the lungs, causing congestion, and this is what brings about the symptoms that are seen in children who have the ventricular septal defect. So most of the time it's not something that is really noticed at birth once the child is born, but symptoms arise that allows us to identify this abnormality in children. And some of these symptoms include fast breathing, pausing in between feeds, excessive crying. So when we notice symptoms like this in children, then we should take them to the pediatrician for evaluation, because they are not supposed to be there.
So wait, if my child has a VSD, I mean, how common is it? How often does it happen? And what's the cause of a VSD?
How common? I think we have about 7 in 1,000 live births in Nigeria, and about 40% of all total congenital heart disease worldwide. So that is how common ventricular septal defect is.
Oh, wow. Okay.
Yeah, and it is caused by genetic abnormalities during pregnancy. We can't really say this is exactly what causes it, but a mixture of genetic and environmental factors play a role in the development of ventricular septal defect.
So if there's a family member who has had a VSD before, is it more likely to occur in descendants of that family member? If there's a genetic, probably?
Yes. Yes.
Probably.
Yeah, because it's the most common congenital heart disease.
Heart disease, yeah.
You know, and I like the way you said it. It's a hole in the wall of the interventricular septum, the ventricle. So instead of the blood to go and supply the body with oxygen, because of that hole, the blood reverses and goes back into the lungs. Do you understand? So they present with excessive sweating, pausing in between feet, slow growth, or failure to thrive.
Yes. Yeah. And then sometimes, I mean, we have children who come in and parents are like, his breathing is abnormal because the child is breathing fast, and they have intercostal retractions. If your child looks like she or he is struggling to breathe and there's no cough, that's usually a red flag, because it's like, why is this child having such a hard time breathing? Because like you said, the lungs are flooded. So a patient comes in and has a VSD. What are we looking for? I mean, how do we diagnose it as doctors? What are we looking for on the physical exam?
Physical examination, after the general physical examination, we are going to examine the chest, and that's where we pick up a third heart sound. Normally, we are supposed to have just 2 heart sounds. So these children present with a third heart sound or a murmur. Because of the hole, there is... Yes, it keeps going. And also depending on the size of that hole, so we pick a murmur, a third heart sound on examination. And then for investigation...
Is there any special name for the murmur? Is it like, they call it
holosystolic murmur?
Holosystolic murmur.
Okay. Yeah. All right. Because, sometimes you think, it's like, I think that's what the name is. Yeah, it's a holosystolic murmur.
And together with the history of poor suck, excessive sweating while feeding, So
They're
that
always
triggers,
tired.
they're always tired, and the
Yes.
mother is going like, she's breathing fast, this whole place is going inside. So
Yes.
that triggers them to come to the hospital.
Yeah.
So the pediatrician looks for a murmur.
Yes.
So once we get the murmur, we can now request for further
For further,
investigation.
yeah. Okay, so there's a murmur. The child has a holosystolic murmur or suspicious of a VSD. What do we do next? I mean, the parents will be like, "Oh, my child is really sick." So what do we do next with the?
I think the next thing will be to carry out investigations to confirm the diagnosis and then refer to the cardiologist for proper management.
Pediatric cardiology, yeah. I had a child actually, I've had a few children, but they came in intercostal retractions, breathing very fast. And remember what we talk about in pediatric as the vital signs. Vital signs. That heart rate is up, respiratory rate is up. And then I'm listening. Oh, I don't hear. Then I listen to the heart. Oh yeah, there's a very loud murmur. And those murmurs you can almost like even feel them. Yes, they are like thrills. So it's like, okay, pediatric cardiology, and then pediatric cardiology, usually they would do EKG, echo, yes,
ecocardiogram,
chest X-ray, EKG.
Also look at the base of the lungs,
Yeah. So what is the treatment? How is it treated?
Okay, for the treatment, it depends. It depends on the size of the hole.
Okay.
For small holes, they close spontaneously.
Usually, how long does it take for those holes to close?
Let's see.
In the first 6 months, as the child grows older, they close.
They close. Okay. So that's good to know. So not every child has to have heart surgery.
Yes, not every child has to have surgery. And for the bigger ones, they go through the surgery like you mentioned.
Yeah.
And there are minimally invasive surgeries these days that can be done to help close the defect.
What are those, like balloon
like a catheter?
Yes.
The catheter.
The balloon.
Balloon septostomy. Let me not try and be the expert in cardiac surgery because.
And once you see a child with a VSD, it's important to look out for other conditions because it can be an association.
Yeah.
Because we've had cases of a VSD in a child with a tetralogy of Fallot,
Yes.
or a child with coaptation of the aorta, and they're also associated with atrial septal defect.
Yes.
So seeing all patients, you must have a high index of suspicion
and Down syndrome.
As well.
You tend to have.
To look out for all those other congenital abnormalities.
And the common name for VSD in Nigeria, when you say, oh, there's a VSD, usually hole in the heart. And it's such a big deal in Nigeria generally. Yeah. But all around the world, cardiac surgery has come a long way. My husband is a cardiac surgeon and he does these surgeries. And generally, at the end of the day, how do they do? Because the child has had heart surgery.
Oh, they do.
If they needed it. Yeah, they do very well.
Yeah, I've seen a couple of them.
So they can keep up
follow-up.
their exercise tolerance.
Yeah, they catch up with growth. Exercise tolerance, it may be minimal but still good. Yeah. So it's not as bad as we always think it will be.
Yeah. The thing about Nigeria, some children, they are not diagnosed early.
Yeah.
So if they're not diagnosed early, what happens?
Most of the time they present with failure to thrive. They don't grow as well as their peers in the same age category.
Yeah.
So they end up with probably heart failure because the heart has been working
so
repeatedly over time. Yes.
So for those kind of children, what does one do?
Just management. Then we start, once we detect it, we start the appropriate management. Yeah. We give them anti-failure regimen for the heart and then try to close up the defects to prevent further damage.
Okay. All right. Dr. Mary, do you have anything else?
Basically, it's just counsel on lifestyle because the child needs to reduce activity, place on anti-failure medications, spironolactone, furosemide, and also what's the word? Carry on with follow-up in clinic. Yeah, because most of these people that don't end up getting the surgery is basically due to financial support. Some of them don't have the means to pay for the surgery. And some of them also stay in a remote environment where there are no skilled healthcare workers or a cardiothoracic surgeon present.
Yeah. In the developed countries, they already have systems in place to help. Yes. Well, here in Nigeria, I understand what you're saying.
Problem. So
there's a lot of need. And at the end of the day, going to the university hospitals is is a solution, can offer a lot of
It's a
solutions.
solution, but they're also overwhelmed.
Yes, they're it's true.
And most of these people don't even deliver in the hospital. They rather give birth at home.
Yes.
Yes.
And the thing is, in the US, for instance, there's this 20-month, actually, I'm sure there's even more. There's all these ultrasounds that people do. So they are diagnosed prenatally. So before they're even born, you know, okay, this child is coming out with a VSD. But, you know, here in Nigeria, there's still a long way to go, but we'll get there, right?
Yes, so
That's the
we pray
plan.
so. We pray so. We
Yeah.
pray since I was born.
Well, there's a lot of private organizations that sponsor cardiac surgery too. Babcock is actually a very, well,
Yes, they've done some.
Babcock
cardiac
has done a lot.
surgeries, yeah.
Lastooth, there's
Even
CT
Luth.
surgery in Lastooth and Luth.
Yeah.
Yeah, and I guess, you know, there's a website that talks about where to get cardiac surgery in Nigeria, especially pediatric cardiac surgery. So I think the most important thing is to have the parents go to Luth or Lastooth if you're in Lagos, and then they'll be able to point you to the other options that you have. And then in private practice, there's a few other places, but it's all online. Okay, do you have anything else to add?
No, I don't.
Okay, thank you, Dr. Marianne.
Thank
Do you have anything else?
No, I think she has basically said.
Yes,
most of-
keeping it simple. Okay.
Yeah.
All right. So thank you for joining us today, and we'll see you next time. Thank you, and have a good
Bye.
day. Bye bye.